Hello and welcome to your preoperative video. I'm Dr. Victoria Karlinski, and I decided to create this video to hopefully help you prepare for your operation, answer some of the most common questions that you may have, and alleviate some of the anxieties that you may have prior to your operation. I'm going to go through most of the common procedures that we do and give you most important information that you need to know. If there's something that I miss in the video, we will certainly discuss it in person when I meet you. First and foremost, everybody has to know that prior to your operation, you're going to need to have either basic lab work or basic lab work with medical clearance. That's going to depend on your age. If you're younger than 40, then you will only need to get basic lab work if you have no medical problems. If you're younger than 40, but you have any type of medical problems like diabetes, any type of heart disease, endocrine disorders, we will need you to get medical clearance as well. Under 40 with no medical problems, just lab work, and my staff will provide you exactly with what type of lab work we need. If you are over 40, even if you have no medical problems, you will need to see a primary care doctor and get medical clearance with an EKG and a letter stating that you are in good health and your doctor has no problem with you undergoing the surgical procedure. Anybody who is over 50 will require to get a cardiology clearance to ensure your safety of general anesthesia and the surgery itself. We can start with the tummy tuck. It's one of the most common procedures that we perform. So if you are a patient who's getting ready for an abdominoplasty or a tummy tuck, or what's called an extended tummy tuck, here are the things that you need to know. On the day of surgery, you will come in. We will take pictures. We will do all the markings. Certainly we'll go over everything again, and I will answer any of the questions that you may have. Please make sure when you come in, you wear comfortable clothing. Make sure that you bring a pair of socks with you. It always helps because the operating rooms are always very cold, so your feet can stay warmer. You're going to be given a pair of compressive stockings. You'll be able to put that over your socks. And the compressive stockings can be removed the day after surgery. You do not need to keep them on for days and days and days. The day after surgery, you can certainly remove them, with the understanding that you have to start walking immediately after the operation. Now, specific to the tummy tuck, remember that I'm going to be suturing your muscles together in order to give you a much flatter looking belly, which means that you're going to feel very tight and very uncomfortable. It's perfectly normal, and over time will get better. You're going to have a tendency to feel like you want to slouch because it feels very tight, and I always tell my patients, try to straighten yourself out as fast as you can, because the more you slouch, the worse pain it becomes. You're going to get pain in your back, and then you're going to have pain in your abdomen from the back spasm. So just remember, stand up straight. You do not need to worry about ripping anything. The incision is closed in 3 layers, and it's nice and strong and tight. So you do not need to worry. Remember, you're going to have 2 drains, one on each side of the incision. The drains will stay in for approximately 10 days. For some patients, it's a little bit less. Very, very rare, it's more than 10 days. I will give you a prescription for antibiotics for 14 days, and you will start your antibiotics the day after surgery, and you're going to continue them for as long as the drains are in. Once the drains come out, you'll be able to stop the antibiotics. Of course, you will also have a prescription for pain medication, which you'll take as needed, and a prescription for anti-nausea medication to be taken only if you feel nauseous. If you do not feel nauseous, you don't need to take the nausea medicine. Now, most of you already know, but just in case, at least 2 weeks prior to surgery, I don't want you taking any Aleve, aspirin, ibuprofen, naproxen, or any non-steroidal anti-inflammatory medication. Only Tylenol is okay to take 2 weeks prior to surgery for any aches or pains. If you are a patient who takes 1 aspirin a day for your high blood pressure or cardiac issues, you must clear it with your cardiologist whether or not you can stop aspirin for 2 weeks prior to surgery, because it is extremely important that you don't take the aspirin for at least 10 days in order to minimize the risk for bleeding. But your cardiologist has to give you permission to stop. Now, after surgery is a different story. Believe it or not, Advil or ibuprofen, and that happens to be my favorite. Some people like Aleve or naproxen or Motrin, happens to be very helpful after the operation. And I allow my patients to interchange Percocet with ibuprofen or Advil literally immediately after surgery, because the risk for bleeding while taking ibuprofen or Advil after the operation is minimal. I allow my patients to take 4 tablets of Advil, which is equivalent to 800 milligrams of ibuprofen, in between their doses of Percocet, if they feel that the Percocet alone is not helping. Your anti-nausea medication, I think I already mentioned, you take only if you feel nauseous. Now, potential risks and complications. Remember that it's a real operation, so potential for infection, bleeding, poor scarring, asymmetry, need for revision surgery, potential for wound separations, need for wound care, potential for deep venous thrombosis or blood clots in the legs, pulmonary emboli, potential for pneumonia or other complications from anesthesia. All of these things are possible. This is the reason why I will provide you with my personal cell phone number. And I'm on standby for my patients 24/7 in case they have any concerns, any urgent matters. They can always reach me, or you can always reach me. I do ask that you're mindful of the fact that it is my personal number. And if a matter is not urgent, I ask that you contact me during normal business hours, Monday through Friday. You can always text me 9 to 5, and in between surgeries, I will answer you as soon as I can. Certainly, if it's something that makes you very worried, you can contact me anytime. Now, remember, if you are in the position where you think that there is a life-threatening emergency, please contact 911 and call the ambulance right away. Do not wait for me to pick up the phone. The next procedure I'd like to talk about is breast augmentation. It's also a very common procedure, and I think it's important that a few factors or a few most important things are discussed. Number one, for breast augmentation, sizing is extremely important. And the way you can figure out what would be the right size of breast for you is simply by doing a rice exercise. I ask my patients to buy a bra that they would like to fit into. You take some rice, a Ziploc bag, and a measuring cup for cooking. You know, those Pyrex cups that you can use, you see where the milliliters are, the ounces are. You put on the bra that you would like to fit into, and in the Ziploc bag, you continuously add rice until the point where when you put that bag with rice into the bra, it's completely filled out. Once it's fully filled out, I ask my patients to simply put on clothing over that bra. Put on the stuff that you wear to work, clothes you wear at home to hang out, a cocktail dress that you would wear to somebody's wedding. And take a look and see, does this size make you happy? If you get to a point where you feel comfortable and this is exactly what you're looking for, all you need to do is take the rice from the bag and put it in the measuring cup and see how many ounces of rice it took to get you to a point where you like the way you look. However many ounces you come up with, you multiply that by 30. So for example, if you have 10 ounces of rice that it took to fill in the bra that you would like to fit into, you multiply that by 30, and that's going to give you 300 cc's. So that gives me an idea that you would be happy with approximately a 300 cc implant. And then we can decide together on a day of surgery, finalize the size, and I will confirm it with you and make sure that I have your implants going into the OR. But this way, you know exactly what it is that you're getting and the kind of look you're going to have after the operation. Certainly, I will advise you as much as I can and make sure that what you're getting is appropriate, safely, number one. Because remember, if you happen to be a patient who has very little breast tissue, if you have less than an A cup, but you're looking to get a 500cc implant because you really want to be a triple D, probably that's not going to be possible. Because if you have that little space in your chest, putting in a very large implant is just not safe because your skin is not going to be able to heal and the incision will simply break through. I'm sure many of you have heard implants falling out because they were just so big that the wound itself was not able to heal and completely broke. So safety, remember, is always the number one concern. Now, potential risks and complications of a breast augmentation include infection and bleeding, just like any surgery, just like what I've already mentioned. Potential for rippling or this kind of irregularity in the skin if the implant is way too big or the skin is extremely thin. Potential for capsular contracture, which is the number one most common complication that we see after breast augmentation. While it's not a dangerous complication, patients simply have to remember that they may need additional surgery to fix that issue because we need to take out the implant, remove the scar tissue, and in most cases, and my preference is to also change the implant. Certainly, another thing to remember is that if you develop capsular contracture, doing revision surgery does not guarantee that you will not have another capsular contracture. That is just the potential inherent risk that you have to accept if you choose to have the operation. Now, the truth is the capsular contracture rate is fairly low, especially now with the new implants. The companies that make them have gotten extremely excellent at the quality of the silicone implants that we place, and the risk has gotten to be very low, but it still exists. The question about silicone and saline. Many years back, I used to always try to convince my patients to go with saline implants because we still didn't have the studies that are available now showing the safety profile of the silicone implants. Now, my advice and my feeling is that silicone implants are essentially just as safe as saline because they're now highly cohesive gel, so the gel doesn't leak anywhere, even if the shell breaks. And certainly feel-wise, there's no question silicone implants feel much, much better. So my advice is always go with silicone if you can. Certainly, if you feel uncomfortable or for one reason or another, you make your choice to go with saline, the results are the same. You still have the same augmentation. Simply, they may feel a little bit different. And if you're extremely thin, you just have to be prepared to feel almost like it feels like a bag with water underneath the skin. Now, the next thing I would like to address is a breast lift and a breast reduction. The operations are very similar. Remember, both include a breast lift. Simply with a breast reduction, it means that I'm removing breast tissue not only to lift the breast, but also to make it smaller. But both breast lift and breast reduction means that the breast is coming up, that it's not going to be hanging, and your nipple areola complex is now going to be facing forward instead of down. The rules are the same for all surgeries in terms of medical clearance, preparation. What you have to remember about a breast lift or a breast reduction is that, and this comes up very often, and I feel like it's something that has to be addressed to all my patients so that you guys have a realistic expectation about the procedure. When first a breast lift or reduction is done, with implants or without, it almost looks like the breast is very high on the chest wall. Looks like as if you have an implant. But over time, remember that the tissues settle, especially for women who've had very ptotic or saggy breasts, very thinned out skin. Remember, the skin doesn't have the elasticity of an 18-year-old. which means that no matter how you try, it will still sag down, or it doesn't really sag, it just comes down so that it becomes more of a teardrop shape and it doesn't stay on top of your chest as if you put in an implant in a small breast. It's very important to remember, because I can tell you that I've had multiple patients feel very disappointed because they started off with the implant, with the breast sitting all the way on top of their chest, a lot of fullness on the upper pole. And then over time, in about 8 to 12 weeks, of course, the breast comes down, looks more like a teardrop, even though, remember, your nipple and your areolar complex is going to stay where it is. You'll still be able to wear a dress without a bra, but you're not going to have that fullness on the top. A lot of times, not even if you put an implant at the same time as a breast lift. It does add some volume, especially for those women who have very thinned out, very ptotic breasts. I think it's a very nice option to have, to put an implant in. But remember, again, it's not going to stay all the way on the top. It just never does. Gravity takes its effect no matter what we do. Now, the size of the implant, if you are having a breast lift, remember, when it's combined with a breast lift, we're limited in the size of the implant we can put in, because I need to have enough skin to close the new breast envelope to ensure that it's not very tense, so that the wound doesn't break down. And I can tell you that in 12 years of doing this, I have seen it all. And I've had patients who broke down their wounds even with a small implant, because sometimes the skin just doesn't have the integrity that it perhaps did earlier in your life, before you had children, before breastfeeding, perhaps before losing a lot of weight. So this just goes back to say that this is real surgery, and we have to be very cognizant of the fact that there are potential risks and complications, and everything we do, first and foremost, has to be to minimize the risk and make sure that you're safe. Your happiness with the procedure, while it is extremely important, comes in number 2 place. Now, remember, breast reduction or breast lift carries with it not only potential for wound separations, infection, and bleeding, just like any surgery. The 2 inherent potential risk for those operations is potential to lose sensation in the nipple areolar complex, as well as potential for necrosis of the nipple areolar complex. It is one of the most feared complications for this particular surgery, where the actual nipple and the areola do not have enough blood supply and they do not survive. The skin turns dark, black, has to be debrided, and then a nipple areolar complex has to be reconstructed. It happens extremely rarely. Knock on wood, I say it all the time. In my career, I've never had anyone lose a nipple areolar complex, but it doesn't mean that it's impossible to happen. So we always have to be very vigilant. Patients have to be informed. You have to know that it exists. And certainly on my end, I will do everything possible to ensure that this doesn't happen. Now, all the incisions for this procedure, even though there are a lot of them, remember, it's an inverted T-scar, which means that you have an incision around the areola, down the middle, and underneath. All of them are closed with absorbable sutures. They dissolve by themselves. There will be sticky tape covering your incisions. I ask that you remove that tape about 10 days after surgery. And then you can use silicone strips, which you can order on Amazon, to improve the scars. Also, after these operations, there's no problem to shower the day after surgery. I do ask, however, that everyone showers, especially the first day or 2, with assistance, because I always worry that somebody's going to fall and hit their head in the shower. So just be very careful, because sometimes after surgery, you may feel a little bit dizzy between narcotics and anesthesia. But you can shower. There's no problem there. You can wet the incisions. You simply pat them dry, and then you put your surgical bra back on. In terms of the surgical bra, it's there only for your comfort. So if you feel like you want to keep it on because it gives you good support, keep it on. If you feel like you want to take it off because it's just too uncomfortable, there's no problem to be without it. In rare cases, specific to breast reductions, I may need to leave a drain in, which usually stays for only 24 hours. That typically happens for patients who have very, very large, very heavy breasts. And when we remove a lot of the breast tissue, it leaves large potential spaces. So to avoid any fluid accumulation, sometimes I have to leave a drain. I will most always tell you on the day of surgery whether or not you can expect to have a drain or it will not be necessary. Now, the next procedure I'd like to give you some information about is a Brazilian butt lift, which is a very, very common procedure that we perform in Miami and in general in everywhere in the United States. And I want to sort of take away some of the misconceptions that a lot of my patients have and come with on the day of surgery. So again, all the instructions are the same on the day of surgery. When you're considering to do a BBL, or if you're scheduled for a BBL, most likely you're going to be scheduled to have liposuction of your full abdomen, your flanks, and your full back. Every once in a while, depending on the amount of fat someone has, patients can add liposuction of their arms or maybe their outer thighs, inner thighs, really very much depends. Remember that specific to Florida, we're limited to being able to remove 4 liters of fat at a time, which means that we cannot remove all the fat. And so you have to have a realistic expectations that not everything completely can be removed or even should be removed, because if you try to remove too much, remember this is when you start to get into really significant irregularities in the skin where it starts to look very wavy, starts to look very uneven, and is a telltale sign that somebody had liposuction. Remember, liposuction is not a weight-losing operation. It's a body contouring operation. And it's designed to improve the overall shape of your torso, especially when we inject the fat into your buttock. The combination of cleaning up the torso and also improving the shape of the buttock, adding more to the hip, giving you more projection, these two things work in symbiosis. They add to each other to give you an overall very pretty appearance, feminine appearance of the body, but at the same time, realizing that you cannot remove all the fat. Now, the fat that gets injected into the buttock, please remember that about 40% of what we put in is not going to survive. It's a free graft, which means that we take it away from its native blood supply and we then transfer it to a place where it has to acquire new blood supply. Not all of the fat cells that we transfer are going to be able to get the blood supply in time. It is really within that first 72-hour window where the cells have to get their new blood supply that they will survive. And this is where it becomes very important. Pushing in the fat just to push it in does not work, because if we create a big clump of fat in the tissue, what happens is the fat on the outside of that clump will get the blood supply from the adjacent tissues, native tissues of the area. But the fat that sits within that big clump of bubble will never live because it's never going to be able to get the blood supply fast enough. That's why, remember, we're limited to the amount of fat we can put in one time, depending on the size of your buttock. Some women are wider, larger, or men for that matter, and we can put in more fat. For women who are much more petite and have much smaller spaces, of course, we're able to put much less fat safely. The other concern, of course, is always, and I'm sure most of you have heard, potential for fat embolism, which results in almost instantaneous death. This is extremely dangerous, and this is why we never inject fat under the muscle. The fat can only be distributed from deep to superficial layers in the subcutaneous plane. And that's another limitation as to how much we can put in one time. So remember, there's always a potential you may want to add more fat in the future. Now, not sitting on your butt. This is a very important point. You can sit on your butt. There's no problem about sitting on your butt. I just don't want you to sit down on your butt right after surgery and stay that way for a prolonged period of time. I ask my patients to move around. You kind of sit a little forward, a little sideways, but there's no problem to sit on your butt. Remember, no matter what you do, about 40% of what we put in is going to go away. And I always tell my patients, if you wake up and you look at your butt for the first time and you say, oh my God, this is horrible. It's way too big. I didn't want it to be so big. Don't panic. 40% will go away. If you look at your butt for the first time and you say, oh my God, this is beautiful. This is exactly what I wanted. Don't hold on to it. 40% will go away. I want you to have a realistic expectation about this because this is exactly what happens. Okay. Now, the lipo part of the procedure, and this goes also for just patients who are getting ready for simple liposuction. I do not like to use drains for my patients. I find them to be a big pain in the butt and I think they're very uncomfortable. So wherever possible, I avoid using them. The only time I may use a drain for a patient for liposuction is if you have significant amount of excess skin and you still made the choice to have lipo instead of a tummy tuck. And I know that there'll be a lot of excess space. I will leave a drain in on the bottom of your abdomen to stay in for a couple of days to collect some of that fluid and minimize the risk of you getting a fluid collection. For everybody else, wherever liposuction is performed, and through that little incision that we make, I leave those incisions open, which means that the first 24 hours, there's going to be a lot of drainage. And the drainage is like this bloodyish looking water. It gets very messy, which is totally normal. So to prepare, I ask that you buy yourself a big pack of maxi pads, and whoever's taking care of you after surgery, they simply need to open up your garment, take out a wet maxi pad, and wherever there's that little incision with a Band-Aid over it, you just put another maxi pad in. As always, you continue to move. You sleep off your anesthesia, you get out of bed, you move around. The more you move, especially the day of your surgery, the faster all of that fluid will come out and the less swelling you're going to have. If you are standing up changing your pads, remember to do it somewhere where there are no carpets or rugs because, again, it gets very messy and I don't want you to ruin your expensive rugs or carpets. Now, the story with the faja. I know that all doctors have different preferences and different advices. For my patients in particular, my advice is to wear only the compression garment that is comfortable for you to wear. If you're putting something on and it hurts and it's uncomfortable and it's driving you insane, you should not be wearing it. Fajas do not make results. The surgery gives you results. Faja or any kind of compression garment is there only to provide you with comfort. And that comfort means that it gives you external support. It helps you to move around, get back to your normal life, and minimizes some of the pain or the swelling. And again, I mean it. Fajas do not give you results. Surgery is what gives you the results. The compression garment is there only for your comfort. Now, you can wear the compression garment as long as you like. My basic recommendation is to keep it on full time for the first week to 10 days, so day and night. You can take it off, you can take a shower. There's absolutely no problem with being without your compression garment. And then you put it on. You can change them. You can buy whichever compression garment you feel comfortable. I do ask that whatever you wear, you pay attention to make sure that it doesn't dig in anywhere, it doesn't create dents or irregularities, which some garments can. It should be a very smooth, very clean compression so that everything stays smooth in the skin. Because remember, the skin can be very impressionable immediately after liposuction. It tends to dent in wherever it's being dent, and potentially if you continue to dent it in the same manner, it will scar down this way. So always keep everything looking smooth and clean. Okay, so far we've gone over a tummy tuck, breast reduction and a lift, Brazilian butt lift, breast augmentation. I think this should probably conclude this video. And I hope that this kind of answered a lot of the questions that you may have in preparation for your surgery. For those of you who are getting ready for a mommy makeover, that all this whole video encompassed all the information that you need about your upcoming procedure as well. Now for the follow-up. Typically, because there's now with COVID and in general, because you are going to have my cell phone number, remember that I ask you to send me a text message the night of your surgery. I just need to know that you're doing okay, that your pain is under control, that you're able to pee, that you're able to eat, you're holding food down, and that your pain is under control. Certainly, if there are any concerns or any issues, you're welcome to get in touch with me anytime, day and night. The day after surgery, I will ask you to send me a picture of the area that we worked on. Make sure that whatever pictures you send me does not include your face in it, if it can be avoided. And it's a way for me to ensure, while you are going to come in for your 24-hour checkup at the clinic, just in case if I am in surgery, this way you don't have to sit and wait for me. You can be seen by a nurse, and I can check and make sure also that everything is okay. Also, I ask for a 1-week follow-up. If you're already at home and no longer in the Miami area, I ask that you send me a picture and follow up with me so that I can check and make sure that everything is healing well. And then 3 months down the line, I always ask my patients to send me a picture so I can have the final result of their surgery. This way we can always compare, and I can certainly send you your before pictures as well. They will always be in my files, and they're available to you anytime you like. Okay, I think I've discussed pretty much all the important things that you need to know. One thing I do want to mention, for those women who have to make a choice of breast lift with augmentation or just the breast reduction, the way you have to think about it is, if you are happy with the size of your breasts and all you really want is for them to be more perky or more lifted, then you do not need implants. If you have very large breasts, you certainly don't need implants. We just need to do a reduction. If you happen to be a person who really needs a breast lift, but you also want your breasts to be larger, then you're a great candidate for a breast lift with an implant. So this is an important point in helping you make your decision whether or not you need implants with your lift. Okay, I think I've gone through many important things in this video. I hope that this gives you a lot of good information and it actually puts your mind at ease. And I look forward to meeting you and doing your operation. Thank you so much for watching. Bye-bye.